Erectile dysfunction, ED, has long been viewed through the lenses of aging, stress, or hormonal imbalance, but new evidence suggests it may also serve as a critical early warning sign of prediabetes. In fact, ED often surfaces years before more overt symptoms of metabolic dysfunction emerge, acting as a vascular red flag that something deeper is going wrong. For clinicians and patients alike, this connection signals the need to rethink how sexual performance issues are evaluated, not just as standalone complaints, but as potential early indicators of systemic metabolic decline. The biological link between prediabetes and ED is grounded in blood flow. Erections depend on healthy, responsive blood vessels, which are among the first structures to be affected by elevated blood glucose. Even before a formal diabetes diagnosis, higher than normal blood sugar can impair endothelial function, reducing the availability of nitric oxide, a key molecule that allows blood vessels to relax and fill penile tissue with blood. The result is weaker, inconsistent, or delayed erections. This vascular impairment mirrors the early damage occurring elsewhere in the body, including the heart, kidneys, and brain, but may show up in sexual function first because of the delicate, high-demand nature of penile circulation. Prediabetes is also associated with insulin resistance, which doesn't just affect glucose uptake. It alters hormone balance and promotes chronic inflammation. Insulin resistance can suppress natural testosterone production and increase estrogen activity, further diminishing libido and erectile performance. Additionally, this metabolic imbalance triggers oxidative stress that weakens nerve function, adding a neurological dimension to the decline in sexual function. Importantly, none of these changes require a man to meet the diagnostic criteria for diabetes. Just being in the prediabetic range is enough to cause dysfunction, even in men who appear otherwise healthy. What makes ED particularly useful as a diagnostic clue is that it's often one of the first symptoms men notice and take seriously. While high fasting glucose or elevated A1C might go undetected for years in routine blood work, sexual performance issues tend to prompt medical attention. But too often, the evaluation stops at hormone tests or prescriptions for ED medications, without addressing the underlying metabolic risk. This represents a missed opportunity for early intervention. Recognizing ED as a possible manifestation of prediabetes could change clinical practice. Men presenting with unexplained ED, especially those under 50 or without major cardiovascular risk factors, should be screened for markers like fasting insulin, HbA1c, and postprandial glucose. Identifying insulin resistance early opens the door to lifestyle interventions that can reverse the trajectory toward diabetes and restore both metabolic and sexual health. These interventions include dietary changes to lower glycemic load, increased physical activity, stress reduction, and improved sleep, all of which support both erectile function and long-term systemic health. ED doesn't have to be just a frustrating symptom. It can be a valuable diagnostic tool. When viewed as a vascular and metabolic warning sign, it becomes a call to action rather than just a problem to manage. For men and their doctors, the question shouldn't only be, what's causing the ED? But also, is this the first sign of something deeper? And if that deeper issue is prediabetes, there's still time to reverse course.